You are now viewing the second of 5 segments on using the Tegaderm CHG IV securement dressing. Let's focus on how to prepare the site for dressing application. Prepare the site according to your facility's protocol. Clipping hair at the site may improve dressing adhesion. Shaving is not recommended. Chlorhexidine gluconate, or CHG, and alcohol is currently the preferred product for skin antisepsis. CHG used for prepping the skin reduces skin flora and provides an antimicrobial effect up to 48 hours. Of course, other acceptable prepping agents include povidone iodine or povidone iodine with alcohol. No matter which skin antiseptic you use, the key is to allow the prep to dry thoroughly. Refer to manufacturer's instructions for use on dry time. After you have completed skin antisepsis and allowed the prep to dry thoroughly, apply any skin protectant evenly to the skin. Avoid the area where the CHG gel pad is placed. If using a skin barrier, 3M Kevlar no-sting barrier film is compatible with CHG skin preps and may be used with Tegaderm CHG dressing. To ensure good adhesion and prevent skin irritation, always allow all preps and protectants to dry completely before applying the Tegaderm CHG dressing or any transparent film dressing. Some skin protectants feel tacky when wet and will feel smooth when completely dry. So, how can you tell if the prep is completely dry? One way is to try what we call the sniff test. On your own forearm, apply your antiseptic prep. Here I am using a CHG prep with a back and forth friction scrub for about 30 seconds. Be sure to time yourself for 30 seconds. Yes, time is relative, and it seems like this is much longer than 30 seconds should be. 30 seconds is about the time it takes to hum or sing "Twinkle, Twinkle, Little Star" once. Okay, now let your arm dry for 30 seconds. Drying time is dependent on levels of humidity and perspiration on your skin. For example, I'm in Minnesota where the humidity is low and I'm not sweating, so that helps. If I was diaphoretic or in a warmer, more humid environment, it may take longer for the prep to dry. After 30 seconds, sniff your arm. Not something you can do on a patient, of course, but on your own arm, you will still smell alcohol. The alcohol has not vaporized off yet. Continue to let the prep dry for up to 1 minute. Sniff again. Do you still smell alcohol? At this time, I don't smell any alcohol on my own arm. The prep has dried completely and you can no longer smell the alcohol. Allowing the prep to dry completely can also prevent skin irritation. So, what does skin irritation look like? Our first example is of a tension blister. Tension blisters may be caused by mechanical force or chemical irritation. Most often, however, this is caused by stretching the dressing upon application and will often be seen at the edges of the dressing. Some patients may state that they are allergic to a particular adhesive, but in reality, they may have had a skin reaction or injury due to a mechanical force or chemical irritant. Folliculitis occurs when the hair follicle becomes infected after shaving, resulting in raised red bumps such as this. Also, the nicks or cuts in the skin will cause discomfort when an alcohol prep is used. If the preps or other products applied to the skin are not allowed to dry thoroughly, the film or tape can trap the wet product, creating skin maceration and/or trapping of the chemical agent, leading to skin irritation. Keep in mind that dry time may also vary due to the amount of prep on the skin or the type of prep used. Check your product insert or the manufacturer's recommendations. Skin stripping typically occurs during the removal step. The degree of skin stripping can be manifested as a reddened area or shiny skin. Skin stripping is more likely to occur in patients with fragile skin or where an aggressive adhesive was used. This can be minimized by following proper dressing removal techniques, as we will discuss in the dressing removal segment. Always follow universal precautions as indicated by your established protocol for infection prevention. For patients receiving infusion therapy, monitor daily for signs of infection or other complications. If infection is suspected, you should remove the Tegaderm CHG dressing, inspect the catheter site directly, and determine appropriate medical intervention. Protect the dressing and IV site when showering or bathing. Provide patients with instructions and supplies to cover the IV site. So, in review, before applying the Tegaderm CHG dressing, remember to let all skin preps and skin protectants dry thoroughly.